Thank you for that forecast, Devin. And we're seeing a boost, though, in COVID numbers right now. So we wanted to remind you of some symptoms and isolation treatment.
And here to give us these reminders is Nurse Christina Paris from the VA. So thank you so much for joining us today.
Good morning.
So we know COVID is a viral infection caused by coronavirus, but can you review some of the symptoms?
Yeah, absolutely. So we're seeing COVID. It's on the rise. People are calling, asking questions about this all the time. Or they're calling because they have a cold. And it's funny because I think people don't realize that you don't have to have every single symptom of COVID for it to be COVID. You know, I would say to patients, hey, did you take a COVID test? Well, I don't have a fever. You don't have to. Or I didn't lose my taste or smell. You don't have to. You could just have sinus congestion and it be COVID. Or you could just have the cough or, you know. So don't just assume it's a cold. And while it might be mild for you, and that's wonderful, I'm so happy for people when it's not significant or serious. But for someone like grandma or grandpa who have other issues, it could be more concerning. So yes, the symptoms are fever, chills, cough, shortness of breath, fatigue, muscle aches, body aches. People will say my hair hurts, headaches, loss of taste and smell. That's kind of a classic one. Sore throat. Nasal congestion, a runny nose, nausea, vomiting, and diarrhea. And again, you could just have one of those symptoms or two and still have COVID.
Yeah, that, you know, always good to be on top of the symptoms and taking a peek at them. And if we do test positive for COVID, can you review some of the latest guidelines for isolation? Like when should you be kind of starting the isolation and when can you leave?
Yeah, absolutely. So first, I just want to bring up testing. So when I went onto the CDC website, now I don't know, you should always check to see first, but it says Walgreens is still giving free COVID tests. Of course, don't just assume, always ask.
Yeah.
You can also call your provider. At the VA, sometimes we have home tests we can give out to veterans. So next time you're in for your physical, you could ask for one if they're available, and get one of those. So once you've taken your test, whether it's a home test, you've gone to the doctor, and you've been tested, you want to start isolation the very first day. So you have 5 days that they want you to kind of stay at home. Again, it's always a good practice, whether it's influenza, just a regular common cold, you want to isolate. So 5 days of isolation, don't go places, don't travel, you know, make sure you're staying home, you're using a separate bathroom, and maybe now that it's summer, open your windows to kind of air out the house a little bit. Don't share personal items like cups, towels, utensils with people. Monitor your symptoms. Know the emergency warning signs like severe shortness of breath, trouble breathing, persistent pain in chest, chest congestion, or you're just lethargic, not able to stay awake, high fever. Those are the things. Oh, so isolate for the first 5 days. The second 5 days, we just want you to wear a mask if you're going to be around people.
Okay.
That's a good thing to know, certainly for folks at home.
Yeah.
Yes. And then we see commercials for medications to help with COVID. And can you review who would maybe benefit from these medications? Because like you said, some people have just like very mild, little to nothing, but some people might have it a bit more extreme.
Absolutely, and there are, you're right, we hear about the Paxlovid and there's others, but people who have asthma, COPD, cystic fibrosis, maybe they're diabetics, have serious heart conditions, or if you're pregnant, you know, go and talk to your doctor. I mean, there's all kinds of other, of course, issues that people might have that they'd want to be concerned about, but that's just a few. So go talk to your doctor because some of the treatments, one, have to be started within 5 days of your symptoms starting. The sooner the better. And there's one that has to be given IV, and the others are taken orally. But they have a lot of medication interactions. So then you have to think, if it's interacting with one of my medications, for COPD or for lung disease or something, is the benefit going to outweigh the risk? So how bad do I have it? If it's just pretty mild, maybe staying on my medication is more important and riding it out. But now if you have it more significant, yeah, then it definitely
something to look into.
Right, outweighs the risk.
That makes sense. And now moving past having the COVID, you've gotten better, you recovered. Congratulations. What are the long-term effects that people might run across?
Yeah, so we're seeing like brain fog that continues, chronic coughs. Some people are getting sick more frequently and easier. It seems to mess with the nervous system. It can mess with your cardiovascular system. Mess with your stomach. It really can cause so many issues. So if you do notice symptoms that are continuing and aren't going away, have those conversations with your provider. Sometimes they can be treated. Others you just have to, treat the symptom, manage it, and just do your best. But always have those conversations with your providers.
Well, sounds good. Well, thanks for keeping us in the know, Nurse Christina. We appreciate it.
Hand wash, hand sanitize, separate. Those are the biggies.
Yes, well, thank you so much for coming in. And coming up, we have